So my topic is to study the clinical profile of Pachychoroid spectrum, disease presenting to a tertiary care center in Northeast India. So I have no financial interest. Next. So Pachychoroid is a phenotype characterized by attenuation of the choriocapillaries overlying the dilated choroidal vessel, which is characterized by a certain specific choroidal changes. The word pachy itself means thick in Greek, so the pachychoroid means thick choroid. So pachychoroid came into the focus in 2013 when Freud and colleagues described the pachychoroid pigment epithelially first. The disease spectrum refers to a group of retinochoroidal disorders that share a distinctive choroidal findings identified with different multimodal retinal imaging. So the diseases which are included in pachychoroid are pachychoroid pigment epitheliopathy, central serous chorioretinopathy, pachychoroid neovasculopathy, polypodal choroidal vasculopathy, peripapillary pachychoroid syndrome, and focal choroidal excavation. So my primary objective was to evaluate the imaging features of OCT or ICGA in patients with pachychoroid disease spectrum. And the secondary objective was to study the demographic profile and to study the clinical features in these patients. It is a retrospective study with a prospective arm, which was conducted in a tertiary care center in Northeast India. 170 patients were enrolled for this study. The inclusion criteria includes the patient willing to give consent, patients more than 18 years, and the patients which were diagnosed with the pachychoroid disease spectrum. The exclusion criteria includes pregnant lady, non-ambulatory patients, patient not willing to give consent, and significant media opacity pertaining to non-visualization of the retina. The study was carried out for 15 months, which had 6 months of period of retrospective study and 9 months was prospective study. When patients came, the basic information like name, age, sex, address were noted for the patient. Complete medical examination and clinical examination was done. A standard fundus photograph was taken for all the patients to see SRF and CSR, RP changes, orange to pinkish nodules, heme, PED, drusen's, and pachychoroid. Eligible patients were advised to go for OCT with SD-OCT with enhanced depth imaging. If required, the patients were advised for ICGA to see the branching vascular networks, polyps, feeder vessels, and pachy vessels. The statistical analysis was done by using software SPSS version 2.0. So in present study, out of 170 patients who were diagnosed with pachychoroid disease and who were more than 18 years, the majority of were in the group of 41 to 60 years. Mostly, the most number of males, and the right eye was including in the most of the patient. Regarding the terrain status, majority were found in the plains. In this study, in this different spectrum that we have seen, more than 50% of patients were having RP, PED, CSR, and next was PCV, PCN, and least were there PPS and PCN. On ICGA, most of the patients were having BVN, followed by the choroidal hyperpermeability and peripapillary choroidal hyperpermeability. So this is the first study to endeavor to detect the pachychoroid spectrum in patients in Northeast India. In the future, this study can help in large population to diagnose patient to prevent blindness from the ARMD and such diseases. Earlier, a very few study has been done for the treatment of this disease. So this study can emphasize on the treatment of the pachychoroid disease. These are my references. Thank you.